Hi, Dr. Spages here, and I want to thank you for downloading the Simple 21-Day Diet. Now, when I put this book together, my goal was to basically make it really simple, something you could easily understand, and something that gets rid of a lot of the confusion related to diabetes and understanding what to eat. Now, be on the lookout. This is actually going to be showing up in your mailbox, in your computer, or your phone or whatever. So be able to look for that. Sometimes it's in spam, so check all through it so you can actually get it, download it, and actually start applying it. Now, one of the things I've noticed over the last 20 years since I've been helping people reverse type 2 diabetes is most people, even when they follow the diet, they still have unanswered questions. They're still wondering, well, why can't I lose weight? Why am I even a diabetic in the first place? When am I going to be able to get off these medication? So what I did was I actually created an entire course to actually answer these questions for you. Now, if you don't know anything about me and it's the first time you're meeting me, you're probably wondering like, who am I? What do I do? So my name is Dr. Jonathan Spages. I've been reversing type 2 diabetes for over 20 years. That means people walk in my office full-blown diabetic, walk out of my office non-diabetic. I have over 2 million views on YouTube. I'm a verified Instagram account. I'm a published author. I've been helping diabetics for years, where I've been on so many radio and TV presentations explaining this radical approach that has a tremendous success rate. So on this page, you're going to actually learn about something that you can do about your own actual health and actually start on your path to reversing type 2 diabetes. I want to spend a couple minutes just kind of going over what it is that I do and more about this course so you can understand what's there. All right, so let's go into this. All right, first off, here's my promise. If you follow the diet and lifestyle tips that I give you, you're going to actually start seeing results. So in the 21-day diet, what you're going to be seeing is like what type of protein, how much protein you should take, how to choose the best protein-rich foods, because these foods that, there are definitely foods out there with good protein, how to avoid sugars, what to do when you have cravings, also which grains you should be avoiding in order to help improve your blood sugar and improve your metabolism. So you'll get that with the training that we do on video. That's really, really good. The next thing that you're actually going to get complimentary, and this has a value of $27, is a comprehensive list of all the foods you should eat. These are things that are easily available in regular grocery stores, and then also what to look for when you're buying groceries. You'd be surprised how many people I meet that go there and say, well, I'm eating something healthy, and it's actually not healthy. And we're not going to get into how bad the food industry is, but there are a lot of things out there that are thought to be healthy, and they are clearly not. Okay, so you're going to learn about that in this free guide. The next one we look at is foods to avoid. Once again, this is a complimentary course or book rather that you'll be getting. So there's over 25 healthy foods that you think are normally good, but they're actually not. And there are foods that secretly increase your blood sugar level when you think they wouldn't do that. So you're going to learn all about these particular foods, and you'd be surprised how many types of foods out there actually make your blood sugar level go up in spite of the fact that you think it's healthy for you or it doesn't have any carbs, right? I'm sure you've had that. So you're going to learn all about that. A lot of times people ask me, well, there's 40,000 different types of supplements out there. Which are the best ones to take? Now, patients in my office, I create a customized approach for them. But in this particular course, I'm going to give you kind of like the basics, the foundation of things you should take. And these are the 10 best vitamins and supplements that you should take. Also, what's the best multivitamin that I've seen throughout the years with people who are trying to reverse their diabetes. Also, what type of vitamin D? Vitamin D, even the ones you get in the store that are like, 90 pills for $10, a lot of them are really bad for you as a type 2 diabetic. So you're going to learn about that, and also a good supplement for stress. Stress and diabetes are not friends. You probably know this. So definitely something you'll learn about there. Guide to toxins. Now, why is this important as a diabetic? Because your body's already kind of toxic. You're taking the medication. You have other things going on in your body. And we want to eliminate that. So you're going to learn actually how to identify toxins that could be harming your body, things that are in the environment that could be causing effects of blood sugar levels. Like, believe it or not, there are some perfumes and things of that nature that do affect blood sugar, and then also how to easily eliminate them. All right. So these are going to be free guides that are part of this course that I'm talking about on this page. And they all have a $27 value. So it's quite awesome that you're getting it free when you sign up for this course. The thing let's look at is you're going to be actually training on a couple of things and topics that I found out that are really, really important. Number one is what causes diabetes. Now, I know what you're told. It's genetic. It is actually not genetic. It's not mom and dad's fault, especially for type 2 diabetes. But what you're going to really see is what is actually at the root of it. why is it that your medications don't fix the problem, right? Like, you know this, if you've been on this medication for the last 10, 15 years and you've taken more medication and more medication, well, clearly it's not addressing the problem. And you're going to understand more about that. And also the remarkable approach that actually works. It's like a miracle. So if you followed me, you'll see that I have thousands and thousands of testimonials. But this is going to show you kind of why they're getting these successes, that where you may be struggling, you'll be learning more about that. Okay, so that's one of the courses you'll be getting for them. The next one is, what is prediabetes, right? Could you have been a pre-diabetic and then a diabetic? What really is prediabetes? Is it something that's important to you? Is it something that can be prevented? And then, how do most pre-diabetics become full-blown diabetics even when they're given the warnings? So you're going to learn all about this on this particular training. The next thing is, and it's so funny, right? Whenever I'm on radio or TV, people are saying, well, what is normal blood sugar levels, right? And everybody gives me a different answer. And there's a reason for that. But I'm actually going to teach you how to know what normal, healthy blood sugar levels are, and also understanding a little bit more about when you get your labs back from when your doctor or nurse run it, what exactly you're looking at, and how to see if you're really getting true progress as a type 2 diabetic. And it's pretty interesting because I have a lot of patients, including nurses and doctors, that come to see me to help them reverse their diabetes, and they don't even know these things. So anyway, we're going to show you in this particular video exactly what is going on, and also, you know, why it is that your doctor tells you, hey, you're normal, everything is good, go refill your prescription, right? Like, it's kind of like, if I'm good, why the heck am I refilling my prescription, right? Like, if I'm so healthy, why am I so sick? So you're going to understand more about that as well. The next one is about exercise. Now, you may have seen me on YouTube or even on TV or radio or whatever, but I talk about exercise quite a bit and how exercise could be bad as a type 2 diabetic. You're actually going to learn more about that. And what's important you should identify is it bad for you? Because there could be things that you're doing that you think are good to do. Maybe someone recommended it, but specifically to you, it's not getting you where you need to be. So you'll learn more about that. Also, how to identify it, as well as making sure that you're not actually causing more harm than good. And then if you do exercise, which exercises are the right exercises to do. All right. So you'll also be learning about that. The next thing is about diet, right? So I'm going to give you really good advice about diet so you can get long-term success. Everybody's done a fad diet. Okay, let me try keto. Let me try intermittent fasting. There's all these new things that are out there. But I'm actually going to show you what the truth behind these are. And remember, we're not talking about managing diabetes. We're talking about reversing diabetes. So, you know, you could be healthy and not necessarily need all the medications, and your doctors can help you do that by getting better. So anyway, you're going to learn about that, and also how to balance your blood sugar level with your diet. Okay, so this is all additional in the course here that you're going to be getting in regards to reversing type 2 diabetes. Okay. The last one I want to get into, and this is the one that probably most people want to know about, is why do I struggle with weight? So the reason why you struggle with weight is very specific. So there are so many people I've met throughout the years that, you know, they're trying to watch their diet. Their diet is actually healthy, and they're trying to lose weight, and they're not losing weight. And it's pretty frustrating. It's downright disappointing and depressing. So I'm actually going to get into why that occurs and what you need to do to actually unlock a slow metabolism and actually start losing weight again. So that's going to be really important information that you'll also be getting, as well as how to address the root imbalances of why your body is actually having issues with weight. When the body is healthy and when the body is functioning well, it loses weight, it balances blood sugar, and they don't take a lot of medication. So this is all a part of the course, and I really am excited about it, as you can tell, because I know that this is the first step for most people when they come to my office, is that, you know, they have direction, they know what they're doing, and they actually start seeing improvements. So if you're interested in this course, you'll get signed up right below. It's at an extremely ridiculously low price. Like, for the amount of hours I put into this, there's nowhere near the cost of what you're getting. You're going to be getting so much value for this that I really want you to improve your quality of life. And real quick, why am I doing this? I don't need patience. I don't need any more accolades. I already have a wall full of it. I genuinely want to help you. My grandmother died early because of type 2 diabetes. She missed my 17-year-old big moment, and that's graduation of high school. Diabetes took her life, and my passion mission, as you will know, is to help you not ever have that experience, not have your family have that experience. And what I do is I create courses like this that it could actually help you lead to a better quality of life. So if you're interested, please sign up below, and I look forward to hearing your successes. as well as how you're improving and your quality of life. So anyway, have a good rest of your day. And remember, be well, stay well. Take care.